guys, it's Mark Poole. Thanks for checking out my video. This is about how to name your operation. You may have a discussion with a surgeon about what you need to have done, or maybe a friend mentions that they're scheduled to have an operation. You're not sure what it means. Maybe this can give you a little bit of guidance. Of course, there are hundreds, if not thousands, of procedures that could possibly be done. There's no way to cover all of those in a short time, but with a few tips, you might be able to have a better idea about potentially what's going to happen. Sometimes I'll have patients come in, they say, "Hey, doc, can you do my operation arthroscopically?" I understand they really mean, can you do it minimally invasively, but it's a question that has no answer. It's like asking, can God make a boulder even he can't lift? It just doesn't work that way. Or the version that my kids prefer is, can God make a snow cone so big even he can't eat it? These are very tough questions, of course, but the point is that sometimes patients aren't sure what the terminology really means. Often, when it comes to procedures, the description of the operation has to do with a prefix and a suffix. The prefix is usually what body part's being addressed, and the suffix is what's going to happen to it. So, for instance, in the chest, where I work, the heart operation would be a cardio something. Lung operation might be pneumo something. Esophago refers to the esophagus. Also, there can be terms for the body cavity, like the thorax would be thoraco. The mediastinum is the middle of the chest, and that might be described. So you have that prefix, and then you have a suffix. So the suffix ectomy usually refers to removing an organ or a type of tissue. So a partial pneumonectomy is taking out part of the lung. You can see that a cardiectomy would not be well tolerated by most patients unless it was the first stage of a heart transplant. Likewise, a bilateral pneumonectomy would also be poorly tolerated by most people. It's not an operation that would be performed, of course, to take out both lungs. So another type of suffix would be scopy. That means just to put a camera in the space and look. So thoracoscopy is taking a camera looking in the chest. Mediastinoscopy, taking a camera and looking in the middle of the chest. Laparoscopy would be looking in the abdomen. Arthroscopy, or an arthroscopic type of operation, would be looking in a joint. So you can see there's no joint associated with the heart, so you really can't have arthroscopic heart surgery, but you might possibly have a thoracoscopic type of operation for the heart in terms of a minimally invasive approach. There are other types of suffixes, such as plasty is a molding or type of repair. So an abdominoplasty is to mold or shape the abdomen. In a cosmetic procedure, you could have an angioplasty that is designed to mold or shape the inner aspect of a blood vessel with the balloon. And those are types of procedures that also can be done. There are many different types of suffixes that could be used, and of course every body part really has some type of prefix, so it's hard to keep track of those sometimes, but these are how the combinations occur. For instance, a laparoscopic cholecystectomy is to put a camera in the abdomen, the belly, and go and take out the gallbladder. A thoracoscopic partial pneumonectomy would be putting a camera in the chest, taking out part of the lung. So hopefully with these tips, you may be able to better understand some of the operations that may commonly occur. Appendectomy, taking out the appendix. And so when your friends mention it, or you're looking to have a procedure yourself, certainly, without question, ask your physician if you don't understand what they're talking about, because you do yourself a disservice if you're not sure what you're getting into. Be sure you get a good description of it in layman's terms. With that, I would invite you to send any questions to me. Happy to answer them. And I hope that you have a blessed day.